Hi there, this video will explain the difference between cyanotic versus acyanotic heart defects. Just to be clear, acyanotic means the person is asymptomatic, doesn't show any signs and symptoms of the heart defect. Cyanotic means unoxygenated blood gets mixed with oxygenated blood, allowing unoxygenated blood enters the systemic circulation and gets distributed to the entire body. Therefore, the person with cyanotic conditions will show signs and symptoms such as cyanosis or a bluish color in the skin and mucous membranes, particularly the lips and the nails. To understand the difference between these two conditions, let's quickly review the anatomy of the heart. According to anatomical position, we have right side of the heart and left side of the heart. The heart has 4 chambers: right atrium, right ventricle, left atrium, and left ventricle. We have 4 valves accordingly: tricuspid valve, mitral valve, pulmonary valve, and aortic valve. Now let's quickly review the systemic versus pulmonary pathway of the blood flow. The oxygenated blood from the body enter the inferior vena cava and superior vena cava. The oxygenated blood dumped into the right atrium, through the tricuspid valve, into the right ventricle, through the pulmonary valve, into the pulmonary arteries. From here in the lungs, the oxygenated blood gets exchanged. Then oxygenated blood leaves the pulmonary veins into the left atrium, through the mitral valve, into the left ventricle, through the aortic valve, enter the aorta and its branches. From here, oxygenated blood gets distributed to the entire body. Did you notice in the picture here that the muscle wall of the left ventricle is much thicker than that of the right ventricle? This is because the left ventricle has to pump blood out to the entire body. The blood here is pumped at a much higher pressure in comparison to the right ventricle. Now keep this in mind because this will help to explain acyanotic versus cyanotic conditions. In a normal heart of an adult, the right and the left atrium should be separated by the septum. But as you can see here in the picture, there is a hole between the right atrium and the left atrium. This condition is known as atrial septal defect. Atrial refers to the atrium, septal refers to the septum. Therefore, atrial septal defects make sense. Now, as I mentioned earlier, the blood from the left ventricle is pumped at a much higher pressure than the right side. Therefore, oxygenated blood is shunted from the left atrium to the right atrium, aka left to right shunt. From here, oxygenated blood is mixed with deoxygenated blood. Both enter the pulmonary circulation, and then oxygenated blood gets distributed to the entire body. Now, this condition is acyanotic because the oxygenated blood doesn't enter the systemic system at all. In this picture here, there is a hole between the right and the left ventricle. In a normal heart, the right and the left ventricle should be separated by the septum. This condition is known as ventricular septal defect. Now, is it going to be cyanotic or acyanotic? Feel free to pause the video and answer the question by yourself. As I mentioned earlier, the blood in the left ventricle is pumped at a much higher pressure than the right side. Therefore, oxygenated blood is shunted from the left ventricle to the right ventricle, aka left to right shunt. Now, oxygenated blood is mixed with deoxygenated blood. Both enter the pulmonary circulations, gets gas exchange in the lungs, and then oxygenated blood leaves the pulmonary veins distributed to the rest of the body. Now, this condition is acyanotic because the oxygenated blood doesn't enter the systemic system. In this picture here, did you notice there is a connection between the aorta and the pulmonary arteries? Normally, the pulmonary arteries and the aorta does not connect. This condition is known as patent ductus arteriosus. Again, the blood in the left ventricle is pumped at a much higher pressure than the right side. Therefore, oxygenated blood from the aorta is shunted back to the pulmonary arteries. Mixed blood goes to the pulmonary circulations. The oxygenated blood doesn't enter the systemic system. Therefore, this condition is acyanotic. In this picture here, this part of the aorta gets narrowed. This abnormal condition is called postductal coarctation or coarctation of the aorta. Coarctation refers to a narrowing or stricture. This condition is acyanotic because the oxygenated blood doesn't enter the systemic system due to the higher pressure in the right ventricle, aka left to right shunt. However, the constriction of the aorta may impede the blood flow, resulting in increased blood pressure in the upper extremities, weak pulses, low blood pressure in the lower extremities, systolic murmurs, and ventricular hypertrophy. But again, this is not a cyanotic condition. Now, there's 4 things going on in this picture. Number 1 is ventricular septal defect. There's a hole between the right ventricle and the left ventricle. Number 2, the aorta is sitting above the ventricular septal opening. Number 3 is the pulmonary stenosis, meaning that the narrowing of the pulmonary valve, which results in number 4, the right ventricular hypertrophy. Because there are 4 things going on in this condition, therefore, it is called Tetralogy of Fallot. This is a cyanotic condition because the overriding aorta receives unoxygenated blood from the right side as well as the oxygenated blood from the left side. Unoxygenated blood from the aorta enter the systemic system. Therefore, it is a cyanotic condition. Alright, let's do the last one here. Did you notice that the aorta and the pulmonary artery switch the position to each other? This condition is called transportation of the great arteries. The aorta receives unoxygenated blood and delivers it to the systemic circulation. Unoxygenated blood gets distributed to the entire body. Therefore, this condition is cyanotic for sure.